Welcome back. Today we're joined by Diane Rindlisbacher, our community leader for COVID-19 testing within Intermountain. And we're going to be talking about how testing works, the amount of tests that we've been doing in Intermountain, and what you can expect when you actually go to get a test and how to get the results. Diane, thank you so much for joining us. We really appreciate it.
Glad to be here.
So can you begin by telling us how many tests have been completed in the state of Utah and also the number of tests Intermountain has specifically completed as well?
Yeah, about a half hour ago, the state announced over 100,000 individuals have been tested. And Intermountain has contributed over 50% of those test results through our efforts. As of this morning, we had logged 53,015 tests.
Wow, that's a lot. And do you know what the number has increased from over the last little while? Like, has that number gone up a lot as we've gotten more testing capability, or has it been pretty steady every day that we're testing people?
Our capacity and capability, both on the lab side and also at our community test sites has just continued to increase. Our average a couple of weeks ago was 800 to 900 tests a day, and our 1 week average last week was 1,400 tests.
So we're seeing an increase, which is good. It means we're able to track the spread a little bit more, which is great. I know that testing for COVID-19 in Utah has also been a collaborative effort with other healthcare systems. Talk to us a little bit about how testing is being coordinated and who is involved with that.
Yeah, at the state level, I interact and participate on a task force called the Community Testing Task Force. And that task force has people like the University of Utah, Steward Health, Test Utah, the Utah Department of Health, and other organizations who really are bringing their resources to bear so that we can help the citizens of the state be tested.
And I know we have a partnership location up in Park City, specifically with the University of Utah. How did that partnership come to be, and what was the reasoning behind wanting to partner with them in a place like Park City?
Well, you know, that's a unique it's a unique story, in fact. We heard that the University of Utah was going to pursue testing in the Park City area, and we had just barely stood up the Park City ice rink, and so we reached out to them and said, hey, why don't we collaborate together? This COVID-19 is really a community event. You know, this isn't a health system tackling it by itself. It can't be the state tackling it by itself. And so we've just elected as an organization to say, who should we collaborate with? And in fact, we do that at the local level. And we recently launched our RV mobile site in Park City also, and had a great collaboration with the Summit County Health Department, the People's Choice Clinic, and really the focus is on where do we need to test and who are the community partners and the other health system partners that we should be working with.
You brought up a really good point about collaboration too, and how it is a community virus. It's not just one healthcare system that's dealing with it, it's the entire world. So I think it's really important and good to see that we're collaborating with our, not competition, but competition in a way, but it's great to see that we can come together as a community to do that. A lot of people too in the country and in Utah really want to know what qualifies them for testing, what symptoms they need, how they get access to testing. How are the decisions being made to determine who can get tested and whether or not we'll see additional changes in that criteria as well?
Yeah, we've had to balance our capability of actually performing the tests and getting a result. And we've wanted to make sure that those two things are tied together. And we've had to look at our supplies. And as we've looked at those three factors, we've also looked at what clinically makes sense. And as we've worked with our state leaders in the lab task force that Dr. Todd Vento and Dr. Bert LaPrancy sit on, we've had conversations about who should be tested based on the symptoms and our capacity to get the individual a test result in a timely manner. There are 6 basic symptoms that we're testing for: cough, sore throat, having a difficult time breathing, muscle aches, chills, and a decreased sense of smell and taste. We've been doing those expanded symptoms for several weeks now, and we'll adapt. I heard on the radio coming in that the CDC is recommending that we test people that are asymptomatic if they're in a high-risk situation, and we would define a high-risk situation as people that live really, really close together in nursing homes or homeless populations, and we'll continue to adapt those criteria based on the community need, what's happening with this virus, and our capability to do testing. In fact, serologies now, serology tests are things that people are talking about right now. And that tests people that have already been infected and needs to be carefully considered under the guidance of a provider.
So you brought up 2 really good points. One is the symptoms. Do you know how long you have to be experiencing those symptoms in order to get tested, or is it, I feel a cold or a sore throat coming on and I have a cough, I should go get tested that day, or should I wait a little bit to make sure that it's actually something that stays around?
Well, the test where we put a swab in your nose to collect a sample is looking for the active disease. And so, I haven't heard anything about a time frame. If you're feeling ill and concerned and have one of these 6 symptoms, I would engage and be tested.
That's good to know. And then the antibody testing that you were talking about too, we've talked a lot about that here with Eddie, one of our infectious disease doctors too, about the fact that just because this test takes place doesn't mean you should go into the community as soon as you get the test back that says you have them, and just being careful about what that test actually means. I know he's talked a lot about how it will help them figure out how widespread the test or the virus has actually gone to. Are you guys looking at that from a state level too, about what that testing can do for you guys?
Yes, this week the state should be publishing guidance on the serology testing. Intermountain helped participate in reacting to the guidance that this and the state wanted to publish or wants to publish. Really, some key points are it's for people that have already been infected, and depending on how each individual's body reacts in terms of building up antibodies, it may or may not show that a positive result, and so we have to be really, really careful. We should still do social and physical distancing. Keep the 6 feet, wash your surfaces, wash your hands, wear your mask.
So let's talk a little bit about the actual testing process. We've seen videos or heard experiences from people that testing can be a little bit uncomfortable to go through. Can you walk us through how testing works at our 25 testing sites and what happens both with the collected specimen and how people access their results once the specimen is processed?
Yeah, so you'll be greeted by individuals wearing personal protective equipment, and they'll explain the procedure. And it's a swab that we have to get to the back of your nose and throat, and so it can be a little uncomfortable. It's not a really long procedure. We put the swab in one nostril. We used to put the swab in 2 nostrils, but through comparing with our partners and looking at the literature, found that one sample from one nostril is as good as a sample from both. as we've learned along the way. After we collect the sample, we put it in a biohazard bag so that properly store it and send it to our central lab, where in 1 to 2 days the results are returned. After the results come back, 2 things can happen. You can look up your result yourself on your My Health account, or we'll call you with your result.
If someone has a positive test, are they more likely to hear back quicker from you, or does it not really matter what the test results are? The timing is still the same.
It's pretty close to the same, but we have 2 different groups calling back with positive results. Both your primary care physician's notified, and our Connect Care APP team are calling back the positive results. So it's about the same time frame. We do pay particular attention to those that are positive.
And I'm assuming that regardless of whether you think you might be positive or negative, when you're getting tested, you should probably self-quarantine while you're waiting for those results. That way, if you do learn you're positive, you're already putting yourself in a good place to continue your quarantine or whatever it's recommended by your doctor as well.
That's exactly right. Not only your own results, but if you've been exposed to somebody that's just been tested as positive, then it's also good to think about what you can do to quarantine, to monitor for symptoms, etc.
And I know that we have those 25 testing sites established right now. How does Intermountain establish or figure out where we put new testing sites? Can you talk to us about what we're doing to reach those in communities who may find it difficult to actually get to the established testing site too? You kind of mentioned this a little bit earlier, but maybe talk a little bit more about it.
Yeah, now that we've tested over 53,000 people, we have data that helps us understand where we may be not testing enough. And we have data that may show us where there's a particular challenge. And we've just recently started to evaluate how easy is it to get to one of our sites on public transportation. And we want people to know you can walk up, you can ride your bicycle, you can drive in a car and still be tested. Sometimes people have been confused because they think it's a drive-up location. We will take all comers, no matter what mode of transportation. If you're having one of the symptoms, please come.
That was actually a question we recently got. Was someone said they didn't have access to a car but wanted to know how they could get to a testing site. I think it's important to know that you guys are thinking about public transportation for those sites, and it's great to know that you could walk up or bike up to a site. I didn't actually know that. Does the process change at all if you're not in a car for getting tested, or is it pretty much the same?
It's pretty much the same. We want to keep you safe from the cars that are driving up, but it's pretty much the same. In fact, when we took our mobile RV, which is also another way that we'll maybe take the test to you instead of you having to go to a testing center. We'll only do the mobile RV in unique circumstances where we have a unique need based on maybe an underserved population like the homeless or others. But we want people to be tested, and we are looking at that every single day.
Is there anything else you wanted to tell us about testing, the most important thing you've learned throughout this entire process, or anything else people should know?
Just because you were tested negative once doesn't mean you'll always stay negative. This is a virus and it spreads. And so if you have symptoms, if you were tested once and it came back negative, but 2 or 3 weeks or a month or 2 months later, you have symptoms that still qualify for a COVID testing, it's probably important to be retested. It doesn't mean you need to be retested every single week, however.
We just had one more question come in as well. Can you talk a little bit about the cost of testing as well?
Yes, people should not be worried about the cost of testing. We will bill insurance companies, but they should not bill you your copays. And if you are you don't have insurance or are unable to pay, we will not charge you a fee.
It's great to know. So testing is available to everyone who qualifies. And like you said, those qualifications will keep evolving and changing. So thank you so much for joining us today. We really, really appreciate it. And if you guys have questions about testing, locations that you can go to testing, you can visit our COVID-19 page at intermountainhealthcare.org/COVID-19. You can also call our COVID-19 hotline at 844-442-5224. They can screen you for any symptoms you think you may have and then direct you to location to also get tested. Thank you so much, guys. We'll talk to you next time.